Hi, this is Dr. Habib. Today I want to just go into the details about masks, how to put them on and how to safely take them off. So generally a regular surgical mask like this is about 70 to 80% effective in terms of particulate that you're exposed to. Now the N95 is about 99% effective at mitigating the exposure to particulates. So the particles for the viruses are very, very small, but again, as I said, that both masks are pretty good. The important thing about the masks is what you do in between, where you put it, how long you put it aside. So a mask like this, you may safely just put it over your ears, pinch it. The problem with the difference between a surgical mask and a N95 is that the N95 has a nice seal. In fact, there are fit tests for OSHA standards that make sure that there is no leakage. So, of course, these surgical masks are not that snug, so you can feel some of the air going in from the side. But generally, it's not bad, especially if you sort of pull it tight. The problem is when you take it off, right? How are you going to take this off? Are you going to take it off by touching it over here? Are you going to take it off by just pulling off the side? My advice is that you try not to touch the mask, because should you have been exposed to the virus, the particulates are going to be on the outside, right? And of course, there's a possibility it's by the ear, but there's a much smaller string. That string was behind the ear. So at all costs, try not to touch that area. So once removing it, you want to just leave it on the side somewhere, because at the end of the day, with a fabric material like that, the virus could theoretically live there for 1 to 3 days. So you should have multiple masks, right? Multiple masks for different days of the week, but maybe multiple masks for different parts of the day. Because hypothetically, I've seen many people go in and out of the car, go into the shops, and then they may come back and grab it. But again, be careful about grabbing it, because you certainly don't want to use the outside on the inside anymore. You want to keep it the same way. And the way to differentiate that is maybe looking at the little notch that were created for the nose. That's one way to know. Making sure that the color, it's the blue color that's on the outside and the white on the inside. But either way, so long as you identify which is the outside and the inside, and you should not touch it. So it becomes more tricky if you're going to use the same mask within a day or two, where you're going to pick it back up and then put it in, because now you want to make sure that you're not touching the outside. And that applies even if you're wearing gloves. So if you're wearing gloves, that's safe. But after touching something, if you touch your face, then you have the same risk as your own hands. So there's the little things about the masks. Now, I do see people wearing these masks inside the car. I don't see any reason for that, unless there's somebody else in the car that you are potentially being exposed by. What's the other thing I could say? I would say that, the contact areas, right? So when you're sterilizing your hand or using hand sanitizer, you might want to rub it on the steering wheel, because the high contact area. So I have a manual car, so the gear stick is something so I would use a antiseptic towel around the steering wheel, as well as the gear stick and the handlebars. So these little things are what you need to be careful about. So in summary, it's about the hands and the face. Those are the two areas. In between, not as important. And so wherever those touch areas, that's what you want to be careful about. So when you take the mask on and off, it's where do you touch it? And so try not to touch it in too many places. And so when you go back into your home, my routine is to take off my shoes. My routine is to take off my outside clothes. But the first thing I do is go wash my hand, and then I take off my outside clothes, then I get into my inside clothes. Once I'm inside, then I shouldn't have to worry about it. Again, this depends on the number of people in your house and how often they're going in and out, and so forth. So that's the kind of general advice. So where to really wear the mask? Of course, the regulation is such that, if you are going to a public place, you have to wear a mask now in Virginia, Maryland, and DC probably. Of course, if you're sick, you don't want to get out of the house, but that's where it's really, really important for you to be covered up so you don't spread it. And that's the main thing. And so for you to wear it in the house is not necessary unless there's somebody else in the house that's sick, or you yourself are sick. In the car, again, there's no need for you to wear the mask unless there's somebody else in the car, or there's more people in the car, and you want to mitigate it. So it's just a barrier, and it's very, very important. And there are techniques of sanitizing it, but when that information is solid, then I'll give that to you. But it's important that when you have a fabric mask, and most masks are fabric in nature, you can't get away with 1 or 2 or 3. You need to have at least 3 for 3 days in a row before you can use the original one again, because that's how long a virus could theoretically stay. But in a given day, you may be in and out of the car. It may be a good idea to have these. These are fairly inexpensive. The N95s get a little bit more expensive, and then of course the 3Ms are a little bit more expensive. Hopefully that helps. And so next, stay tuned for more of the current information on COVID-19 and how it impacts the health of the body and what you could do to proactively recover or prevent the virus in the first place.